Good afternoon, everybody. Starting off, sharing a bit of a picture here. A question for you: how do you keep an arch from falling down? Air pressure. Pressure. Yeah. Another way to say, how do you strengthen an arch?
Strong supports.
You gotta put some tension on it. Look at it closely. As weight is applied, the tension increases and it strengthens the structure. It's starting off with Roman architecture. So if an architect wants to strengthen a decrepit arch, they increase the load which is laid upon it, for thereby the parts are joined more firmly together. If a therapist wishes to foster their patient's mental health, they should not be afraid to create a sound amount of tension through a reorientation towards the meaning of one's life. As a psychologist, as a practicing psychologist, I'm going to talk to you today more as a clinician, practitioner, rather than going through a research presentation. I want to tell you a little bit about the work that I and many mental health clinicians perform on a daily basis to cultivate a greater sense of meaning and purpose, that the goal is to strengthen mental health. First of all, I'll talk about that in depth, but first of all, I want to point out that a tensionless state can be quite perilous, and I see this quite a bit in practice, as most mental health practitioners do. And there's situational factors involved. I'll go through some of those, and then I'll talk a little bit more about chronic aspects. But lots of examples here. I was kind of going through thinking of different clients that I've worked with over the years. And one example is, think about it, going from a pretty radical transition from a very tension state to more of a tensionless state. Had the chance to work with military veterans from time to time, and being discharged, all honorably discharged, but going home, is that a pretty radical transition? And is it kind of going from like high degree of tension to sometimes a tensionless state? Think about it. In the military, do you know your purpose? You know what you're supposed to do. You wake up in the morning and you know exactly what time you have to wake up, what you have to do. You're serving a greater good. You know what you need to do in the afternoon, in the evening, and you go from this very regimented day-to-day schedule, and then you transition home, and that can be very, very difficult. In addition to sometimes PTSD, if you've been through some really rough stuff, going through this radical transition can be quite difficult. Make sense? Here's another example. Have you ever gotten a case of like the end of the semester blues? And I remember as a student sometimes thinking, man, I'm going to feel much better once the semester's over. But then you hit the finish line, and beforehand you knew exactly where you had to be on Monday at 3 o'clock. In your classes and so forth. But then at the end of the semester's there, and you're kind of like floundering around. Where's that tension? Where's that schedule? And sometimes it takes its toll on mental health. Same with working at times with students who graduate. It's strange. You're probably thinking like, oh man, life's going to be good once I graduate. Probably will be. But some will say like, man, I really miss that tension, that role, that purpose that I had, the meaning that I found in exploring different domains of life. And after graduation, it can be kind of rough. Are you thinking of other examples, real world examples of this phenomenon here? Retirement. The literature is actually a bit mixed. You'd think retirement is associated with a high degree of, increased wellness, but sometimes not the case. I remember talking to a suicidologist. There are, folks out there who spend their whole career trying to understand suicide, what predicts it, how to respond to it, how to prevent it. Who said that maybe there's a lot of different factors involved, but maybe one of the factors where we see suicide increase in older individuals, it's the most at-risk category is older males, in fact. And one suicidologist said maybe one variable, amongst other, is that folks find great sense of meaning and purpose in their careers, and they become their job, and when they retire, it basically goes to a very tensionless state without meaning and purpose, and that may predispose to for difficulties with mental health and suicidal thinking and so forth. Others, some of my work has been, quite a bit of actually over the years has been working with individuals that go through faith transitions. For some individuals, the faith transition works very well, but sometimes it doesn't, and they transition out of that. And if you think about it, maybe growing up in that creates a lot of structure, a lot of meaning and purpose. But when people transition out of that, can that lead to a potentially a tensionless state? Where it's like before, kind of had it figured out. I knew my role, purpose, meaning in life, and so forth. But now I have to basically reconstruct, find a new foundation, find a new path going forward that I didn't anticipate before. And it can be a very difficult, a very treacherous path, a lot of work involved. Others, relationships. Do at times relationships in our association, interpersonally, socially with others give us a lot of meaning and purpose? Absolutely. But relationships are fluid. And clinicians, we work a lot of times with people's day-to-day interpersonal relationships, and sometimes they change drastically. Think about, you ever go through a pretty rough breakup? And at times it's quite difficult, and it threatens that sense of meaning and purpose, or a death of a loved one. Sometimes clinicians were working with families where there's been a death of a family, a death of a parent, a sibling, a child, and that really is pretty strong stuff as people have to recalibrate and find a way to go forward. I saw a hand back there. Which one? What were you thinking of?
I was thinking empty nesters.
Oh, good one. Once the kids fly the coop. Although I think some of the research on marital happiness tends to suggest a U-shaped curve, and once the kids kind of go, it seems to kind of go upward.
Yes.
So, yeah. And I think that lowest point sometimes is associated with the kids in the teen years and trying to make all ends meet and so forth. But good one, because potentially that could be a dramatic reorientation as people try to find their way forward. It's kind of like sometimes working with athletes, and the season ends. And it's like before, it was every day, early morning and evening, and now it's kind of like, oh gosh, new chapters. It's how do I find myself? I haven't worked with many professional musicians, but I love music. And sometimes you hear about a band, they do a world tour or something like that, and then the tour ends and they kind of go home and they go oh my gosh, what's going on? Who am I? What am I doing? And it's hard stuff in a tensionless state. Anyway, you get the drift. Can you think of other examples? There's quite a few. Viktor Frankl, who I'm going to talk about in more detail today, is the developer of logotherapy. He compares it to a case of the bends. Ever heard of that? Anybody scuba dive? When you're deep down under the water, and there's a lot of pressure, but if you come up to the surface too fast, you can get a case of the bends. And is it dangerous? It can be lethal. So usually when a scuba diver is deep down under the surface and they got to go up, how do they do it? Slowly. Sometimes they kind of go up, hang out for a while, let the body depressurize, and then step by step they go up. Many of life transitions happen so radically, so fast, where we go from maybe tension to tensionless. At times it can take its toll on mental health in general, and at times it can even be lethal. I think therapeutically, some of the work that I do and others do, sometimes we're working with a person to help decompress. They've gone through a big life transition. We try to do it, slowly together, working in tandem to depressurize, if you will, to create a new sense of purpose and meaning. Let's see. The ones that I just went through, though, aren't they more situational? They're like things happen, and you can tie it to, I came home after doing a couple of years of service, and that's a specific event. But I'm also going to point out that sometimes in clinical work, that tensionless state isn't associated with a specific event. If you think about the nature of some forms of like clinical anxiety, clinical depression, they tend to be more chronic and not necessarily tied to a specific event. In logotherapy, which is just one type of therapy that I'm telling you about today, Viktor Frankl talks about this as an existential vacuum, where the person feels like there's not a high degree of meaning and purpose, and not to say this is the only cause of many clinical conditions, but it can express itself in forms of anxiety and clinical depression. Is loneliness on the radar in terms of health, mental health internationally? It is. I think in the UK, was it just last year or so, they now have a minister of loneliness because they recognize it as a public health issue. And some say that modernity in general, the nature of it, predisposes individuals to experience existential vacuum, or kind of a inner emptiness that sometimes is quite strong and takes its toll on health and mental health. Or a feeling of just being disconnected, bored, which is kind of like meaningless. And there's no shortages of ways that you and I, when we experience this, because we all experience it to some degree, it's part of the human condition, really. Are there interesting ways that we attempt to fill in this, at times, emptiness that we experience? Some talk about this as like vicarious compensation. What do you do? What do you use that sometimes is just like a quick fix to kind of fill in that emptiness? Yeah, there's a lot of them out there.
You read.
Oh, that's nice. Yeah. Oh, that says something about you.
Booze and drugs.
Yeah. But in practice, I don't get too many people coming in and saying, oh, man, I'm just reading too much. Can you help me? I just need to stop reading. I'm like, hey, maybe do some more reading instead of like, some of the other stuff. Anything? What's something that what do you think, clinicians? What do we see in terms of,
Addiction.
yeah, all forms of this. All the interesting forms of this, yeah. Sleep, where a person says, you know what, I'm just not gonna do it. It's like, sometimes it gets to the point where it's like clinical depression, where it's so hard, it's like climbing Mount Everest, to just get up, get dressed, get going. But yeah, you see where this is going. There's all of this and more. It could be anything from just like a quick dopamine hit that just distracts me a bit. I just get on the phone, and hang out on the screen, and for that period of time, I don't have to worry about this existential threat or this greater meaning and purpose questions, big life questions. All sorts of, it increases anxiety, and understandably, it increases at times clinical depression, and people are well-intentioned, they don't like that, they want to do something about it, so at times they'll take different substances, and it tends to be a quick relief where you're not worried about the past or anxious about the future. It just brings you to the here and now. Temporarily it works, but over time it starts to snowball, as many forms of addiction. Whether that's eating, or maybe just going out and throwing some money around, going shopping. But of course, all of this stuff, it's a matter of at what point does it start interfering with day-to-day life? And sometimes we say once it starts, really getting in the way of relationships, and it starts impacting your day-to-day responsibilities and causing quite a bit of distress, then a lot of times say, I think I'm going to reach out for some support. All the AA programs, you know how many there are out there? Different forms. This is just like part of a list. There's so many different ones. And the list kind of goes and goes, and it kind of gets out. This is an issue. And it's something worth talking about and exploring to some degree. Well, I'm kind of in the area of interventions. As a clinician, as a practicing psychologist, I want to provide some support when possible, and this is pretty heavy topics, understandably, and so I'm kind of like, what should clinicians do? What sort of support should they provide? And at some point, I was kind of like, where do I go to find out, learn more about this? So I thought, at some point, maybe I should go to the capital for famous therapists. That makes sense, right? It's like I'm learning. I want to try to figure out what to do. So maybe I'm going to hang out where the bigwigs hung out. Where is the capital for therapists? Any idea?
Isn't it just Germany?
Close. Yeah, there's a lot of good ones there too. It's right south of Germany. In fact, it's right here. Here's Germany. What country is this right here?
Austria.
It's Austria. Good. You know your geography. That's good. Have you been there? I think you were first to say it. Have you been there?
I did. Okay. I didn't say Austria.
Oh, okay. Yeah. What did you say?
I didn't say anything.
Okay. So, yeah, many of the great therapists, whether that's probably if you go out on the street and you ask who's the most famous therapist, who do they say? Freud. Yeah. Freud, practiced in Vienna and went to the University of Vienna. Viktor Frankl, who I'm really talking about today, also practiced there, worked there. Adler, many others. So, and for many years I've been going there, I've been taking students there, and we go and study the history of applied psychology. And we study Freud, Viktor Frankl. So, well, this is a couple of years ago. We're hanging out at the University of Vienna right here. And I want to, just for a couple minutes, compare and contrast Freud with Frankl. It's a fascinating one that I've been very interested in for quite a few years. The one is, they're just begging to be compared. Because Freud and Frankl, both Jewish heritage, World War II, perilous time to be in Europe. But more than that, both are trained as doctors, medical clinicians. They both went to the University of Vienna. They both went to the same gymnasium, like Viennese high school. They both developed different forms of therapy working with people. Frankl was the younger of the two. He's about 40 or so years younger. They corresponded. Frankl started off as a fan of Freud and would send him letters. And Yeah, there's a lot of similarities there. First, Freud, very briefly. Freud is known clinically as the archaeologist of the mind. Freud's approach, in a nutshell, is like an archaeologist. In fact, I've been to Freud's office, both in Vienna and in England. And when you look around his office, you don't see, psychiatry, medicine, psychology books. You actually see archaeology books and artifacts. He took an archaeology approach to the mind, where he would kind of go layer upon layer, and he would take a historical approach, which means he would dig around in people's past. He would dig around in people's childhood and try to find events, things that happened that have been forgotten. And he would try to piece them together like an archaeologist and bring them to more conscious awareness. And the thinking was, as people do this, it kind of reduces the tension between the id and the superego, and it would build somebody's ego strength, so it would basically improve their mental health. But notice, he takes a very historical approach, and he develops a psychodynamic or psychoanalysis, where he has people basically just talk. And his greatest contribution is basically the notion of probably talk therapy. Had some pretty outlandish other ones that are not so much in style. In fact, Freudian psychology generally is not very in style amongst therapists. We use a lot of other approaches, but he did have a lot of influence in this notion of talk therapy. But he's known as a depth psychologist because he takes a very historical approach that goes deep into one's past, one's childhood, and he tries to kind of uncover what is covered up. Even in practice, as a modern-day clinician, when I'm working with somebody initially, we typically do like an intake interview, where we spend some time talking about the person historically. So we really want to understand their history, their development, their family history. We want to understand the complicated family dynamics, trauma. We look at adverse childhood experiences. We look at drug history, medical history. But notice it's all very much in the past. And this does have some utility, but many clinicians say we need more than this. We need more than the past. And this is where Frankl comes in. Viktor Frankl, in his development of logotherapy, which his development of logotherapy is clearly not to replace other forms. It wasn't to wipe away a psychodynamic approach. It was just to augment it. And one of the areas that he wanted to augment was to make sure that clinicians, we are paying attention to not just the past, but also the future. And we need more of this in clinical psychology, in applied psychology, where we pay attention to not just the past, but we look to see where the person is. And we really start thinking and cultivating ideas, goals, a sense of purpose and a meaning that focuses on the future. Freudian psychology is referred to as depth psychology. Logotherapy, Frankl's approach, is recognized as a form of height psychology. Height in the sense that we see a person, we see their potential, and it's kind of looking towards the future, if that makes sense. Frankl, just a quick historical tidbit. I mentioned Jewish heritage. World War II is going down. Nazi Germany is expanding. They basically take Austria. Frankl, his family, including his wife, Tilly, deported. Frankl spends the next 3 years or so in concentration camps. Theresienstadt, Auschwitz, Kaufering, Turkheim. He's moved around quite a bit. And if you're interested in reading, learning a bit more about logotherapy, I encourage you to take a look at Read. You'll like it. Man's Search for Meaning. And this is an international, very well-known book that outlines not only Viktor Frankl's experience in these concentration camps, but he also goes through, in the second half, step by step, his approach to height psychology or logotherapy. My students and I have visited for quite a few years, in addition to visiting Freud's practice, hospital where he worked in clinic and home. We also spent time in where Frankl worked, and it's a small institute, but it's a very important one, and we spent some time there at the Viktor Frankl Institute. Frankl says, as a professor in two fields, neurology and psychiatry, I am fully aware of the extent to which man is subject to biological, psychological, and sociological conditions. Think of what you know about concentration camps. But in addition to being a professor in two fields, I'm a survivor of 4 camps, concentration camps, that is, and as such, I also bear witness to the unexpected extent to which man is capable of defying and braving even the worst conditions conceivable. The basis, the foundation of logotherapy is will to meaning. Freud is will to pleasure, Adler is will to power, Frankl is will to meaning. And going off the adage, the well-known quote by Nietzsche that says, "He who has a why to live for can bear almost anyhow." That's the goal. In terms of the clinical application of logotherapy, first let me play a quick video clip if I can get the technology going.
Let me just recount an incident that happened to me in one of my own concentration camps. I was confronted within a couple of days with 2 people, 2 comrades, the one of whom I knew that they are prone to suicide. Now what happened? I asked both why they wished to commit suicide, to take their lives, and without knowing independently from one another, they told me, "See, doctor, I've nothing to expect from my life anymore." And you know what I improvisingly asked them? Now listen, isn't it conceivable that instead life expects something from you? And then it turned out that one of them was expected by his own daughter, whom he loved above all. In the United States, she had already succeeded in emigrating. And the other then frankly told me and confessed that there was a series of books that he had written and or edited in the field of geography, it was, as far as I remember, and he wanted to complete this series of books. And at that moment there was something like a Copernican reversal. Suddenly the scenery had turned 180 degrees around. Suddenly they saw they have to do something for the world and not waiting until the judgment is issued, death or survival.
So that's Frankl right there. A lot of our work clinically focuses on that change of perspective. And it's nothing very fancy, really. In terms of working with an individual, cultivating that sense of meaning and purpose, we use a lot of Socratic dialogue, where we essentially ask very targeted questions to cultivate a discussion about how a person can create more tension in terms of meaning and purpose in one's day-to-day life. And your handout that I gave you today, a lot of it, as you look through it, are just questions. It's like Socratic dialogue. In intake interviews with clients, in addition to focusing on the past, which at times is important to understand one's history, but I also tend to have those that I work with complete a survey, a meaning and likeness survey. You'll see your packet. It's very brief. It's just 10 questions. some of the questions are like, for an example, I'm looking for something that makes my life feel meaningful. Or my life has a clear sense of purpose. Or I'm always searching for something that makes my life feel significant. Or one item is, when you score it up, if you feel inclined, you can take your answer to these. Number 9, you have to reverse your score. You see how that one's, my life has no clear purpose. You got to score that one the other way. But if you add up your scores, and it's just a snapshot of where you are right now, we think that one's sense of meaning and purpose can be fluid, can change, and it can improve, and it can also tank. But you'll see that as you score it up, it has 2 scores. And one is the presence of meaning subscale, or score, and also your active search for meaning. And on the second page, you'll see what the scores mean. That's between you and yourself. Take those 10 questions, see how you score it. And if you're thinking, yeah, I would benefit from a greater sense of meaning and purpose, here's questions to cultivate, to start thinking a little bit about the way that you're going to do this. I can't prescribe it. Wouldn't it be nice if it was like medicine, where a person comes in and we say, take 2 of these, call me in the morning? It's the same for everybody. It's not the same here. It's very different. It's very personal. It's very individual to you. And how I find a sense of meaning and purpose could be drastically different than the way that you find your sense of meaning and purpose. But what's an example? Here's the first question. What's an example of something that gives you a sense of meaning and purpose in your life? Clinically, as I'm talking to a person, from the very first time I meet them, I'm going to ask this, and I'm trying to target, where do they find that meaning and purpose that creates some form of healthy tension? And as a clinician, I am not picky. I'm not choosy about where they find it. I find that it can come from talking to many, many people over the years. I find it can come from many different domains. And here are some that are listed in your handout. Think about you for a moment, or maybe loved ones that you know. Have you ever had an instance where you were in the process of creating something? Creating, broad definition there. Like maybe you were doing some art. Maybe you were writing a story. Maybe you were, maybe you had some sort of project that was for one of your classes that you found kind of cool, and you kind of got immersed in that. And sometimes we say, like, you found your flow state. So you're working on that, you're immersed in it, it's motivating, and even to the degree where sometimes you lose a sense of time, and it's rewarding. It's meaningful type of work for you. Or maybe as I'm listening and asking the Socratic questions, maybe they start talking about their sense of obligation and responsibility to their kids, or to their grandchildren, or to their spouse, or or to their parents, or so forth. And I'm listening and I hear that, and when I hit it, I'm like, that's gold. That's important stuff to really discuss and explore. What about, here's a good one for you, educational training. Do you feel like what you're doing now gives you a sense of healthy tension? Many of you are like, no way. You don't understand, Dr. Marshall. Let's go on the other way. No, but really, I know it can be like a stressful week, but when you back up and you think about what you're doing, broadly speaking, how it contributes to your life as a whole, do you sometimes go, this may be giving me a sense of meaning and purpose? Sometimes in practice, I kind of go, wow, I'm just so surprised how therapeutic a job can be if it's a good match. I mean, I could grovel around taking an archaeological approach for years and years and say, let's talk about the history and go through it one more time and so forth. But then sometimes I kind of go, once that person has that healthy tension, of like, there's some responsibilities to perform on a daily basis, and they know other people are counting on them, or they find some sort of fulfillment. This notion of like having, a career, with a good fit that fits with one's values is extremely therapeutic, and it's one of the main goals. In terms of, I've worked at times with people that go on disability, and sometimes I think that's a time that I'm going to be, just able to relax and get back on track. And sometimes it goes the other way, where the person doesn't have that day-to-day obligations and that tension, and sometimes it can go the opposite way. Community activity, again, working with youth sometimes, not picky at all. If they're like, yep, I'm on the bowling league, wonderful. I am on the track team, cheerleading. It's like sometimes I'm just kind of mapping out where could those potential opportunities be for meaning and purpose, creating some healthy tension. Hobbies, recreation, spiritual aspects, physical well-being. Do you find a sense of purpose as you activate physically in different domains? To get you thinking more about this in detail, I've got a series of questions, and go through those when you have a chance and think about those different domains. I will point out that logotherapy, again, does not replace other types of therapy. It's just to augment. And many practitioners, we use it to basically really focus on the person and their potential in terms of meaning and purpose. So one of our go-to strategies, interventions for like clinical anxiety and depression is cognitive behavioral therapy. Have you heard of that, CBT? And CBT we really kind of work with the person to develop healthy ways of thinking about the world and themselves as they face adversity and so forth. So we really look at thinking, but we also, it's not just about thinking one's way out of clinical depression or anxiety and other conditions, but we also really emphasize behavioral activation. And behavioral activation is sometimes, when people start experiencing mental health conditions, they start to deactivate. And you know this to some degree. You've either experienced it or heard others, or maybe family members, where a person says, like, I can't get up and go. Like the depression says to me, just stay in bed. It's too hard to get up and go. And really working with individuals, from a CBT, from really emphasizing the behavioral activation aspect, we say, it's kind of like a muscle. It's very hard at first, but with some accountabilities and coaching, working together, we say, let's set some goals to behaviorally activate. And at first, it's going to be quite difficult, kind of like a muscle, it's sore. But as you get going and you start to activate, it becomes easier. And then we start to draw the correlation between activation and more positive mood states. And as a person draws that correlation and strengthens it, it tends to kind of snowball at times. But notice that in terms of like behavioral activation, the early stages of it, we're also not very picky. We're like, okay, let's try, this is like a menu of options that somebody may go through and set some goals. I'm going to, for example, go out and drive around, or I'm going to take a bath and listen to some music. I haven't done that for a while. And these are good ways to behaviorally activate. They're very important from a CBT standpoint. But from a logotherapy standpoint, we want to go beyond that. This is good. We're going to work on behavioral activation. But we also want to move beyond just, sometimes we call them up and down activities, antidepressant activities and depressant activities. Can you think of an example for you personally of some antidepressant activities that you engage in? A lot of them are probably like this stuff, like hanging out with friends, something like that. Those things tend to bring people up. Can you also think of like depressant activities that bring you sometimes further down? And there's a lot of those. But in addition to those, we want to go and incorporate at times a logotherapy approach where we say, okay, behavioral activation, we're working on that, but now let's really focus on what are your strengths? What are your virtues? And use those to really find meaning and purpose in different domains of life. It's like behavioral activation, but a step beyond that, where you start to think about these questions in your handout. So, for example, if somebody is thinking of, let's go with education training, personal growth. We're sitting at a university, right? It's like, how would you like to grow? Like what skills? You know yourself best. What skills would you like to develop? What would you like to know more about? Or thinking about your future career path. What kind of work is valuable to you? What qualities do you want to bring as an employee? What kind of work relationships? Yeah, citizenship. What kind of environment do you want to be part of? What do you want to contribute to your community? In sessions with clients, in addition to the work that we do in many different areas, including CBT and so forth, we really spend some time trying to target questions that will get people thinking a little bit about what do they want? How are they going to cultivate that meaning and purpose that where there's a goodness that fits between that person and their goals that will create that tension. So for you, in university setting, preparing for your graduation, but then beyond that, what are you going to do with that? It's kind of like describe the process of choosing to become fill in the blank. Somebody says, why am I going into physical therapy? Why am I pre-law? So what am I going to do with this psychology stuff? Engineering, accounting, whatever it is. What made you decide on this career path? Tell me the story, play by play. How did you get where you are today? And if you did not have any limitations, money, physical or mental abilities, what would you do for the rest of your life? What's the utility of that one? To kind of say you're off track? Yeah. Maybe just to kind of like cultivate, get you thinking about, well, you said you want to do something related to that. Maybe there's something that you can kind of get where it's a good fit, where you're doing some of that. Is that what you were thinking? Yeah. How would you fill in the blank? I want to be why? What does that say? I'm trying to dig a little bit deeper into your value system. Why did you say you want to be that? What do you want to do with that? What will give you a sense of purpose or meaning in your work as you're kind of like, I have no clue about something. I remember I was on like the 6-year plan, going through school, took some time off, a couple years off, and it's like even if a person is experiencing a state of like, sometimes we say diffusion, they just feel like, I don't know where to go, I'm lost, I don't know what to do. We try to behaviorally activate, but doing it with meaning and purpose, where we kind of move people to like a state of moratorium, where they kind of go experimenting, just trying it on for size, seeing how it works for them. They're like, I think I might want to work with kids, but I'm not sure. Hey, let's do an experiment. Try it out. Find some opportunities to volunteer somewhere where there's kids. They come back and they go like, no, don't want to work with kids. Please. Hey, you learned something. You refined. You found out information that will further direct you. Follow that and find something that's a good fit. So the thinking is logotherapy. We're trying to build a sense of responsibility, where we know that people, there's also this, if there is the ability to make choices, and there is that freedom to make choices, even if sometimes that freedom is quite limited. there's still, even one's attitude is something that can be changed in very, even horrific circumstances, as Viktor Frankl lived in. He said, even in those horrific, traumatic circumstances, there still was the freedom to choose one's attitude, one's approach, to kind of create some meaning out of life despite the different circumstances. So this notion of responsibility, logotherapists, kind of interesting artifact, they said, we really need another Statue of Liberty. On one coast we have the Statue of Liberty, you know, and it's all about freedom and so forth, but Frankl said, we probably need on the other coast a statue of responsibility to kind of just balance it out a bit. This raises the question, how is it possible to say yes to life in spite of all of that? As a clinician, sometimes I'm doing an intake interview and I hear people's stories, their narratives of what they've been through. I'm also a researcher that looks at adverse childhood experiences, and sometimes when I'm talking clinically or sometimes in a classroom I talk about different forms of ACEs, and it's not uncommon that people will stick around afterwards and they'll say, like, you know those ACEs that you talked about? I have like every single one of them. It's like, am I screwed? Or they basically say, how do I go on? And this is hard stuff. And as clinicians, we don't pretend to understand, the why, and try to do any like trite exercises to try to package suffering in a way that's digestible. This is heavy stuff. Frankl, in his own works, talking about meaning and its utility, says this.
So your basic philosophy is that life has meaning under all conditions, but how easy is it when there's a sense of hopelessness, a sense of despair, to recognize this meaning?
Let me confront you with a somewhat strange definition of despair. As I'm used to proclaim is that despair can be explained in terms of a mathematical equation. D, capital D, equals S minus M. What does it mean? Despair is suffering without meaning. As long as an individual cannot see any meaning in his or her despair, he or she will certainly be prone to, in its suffering, I wanted to say, no meaning in the suffering. He or she will certainly be prone to despair and, under certain conditions, to suicide. But at the moment they can see a meaning in their suffering, they can mold it into an achievement, they can mold their predicament into an accomplishment on the human level. They can turn their tragedies into a personal triumph. But they must know for what. What should I do with it? But if people, like so many segments of present-day society and population, cannot find any meaning whatsoever in their lives, cannot see anything meaningful, they more often than not have something to live by. I'd say at least enough to live by. They cannot see anything to live for.
What is the answer to the question, why me? Why did this happen to me?
The answer to such a question is nothing that a psychiatrist or any other type of a scientist can come up. But I would not share the opinion of, say, Jean-Paul Sartre, who said we have to accept and to shoulder courageously, heroically, the absolute meaninglessness of our lives. But what I think is rather that what we have to accept is the incapacity of our humanness, the incapacity to recognize the ultimate meaning in intellectual or merely rational terms. This is the only thing we have to accept. But still, we may believe in an ultimate meaning, but to lead someone, say a patient, to lead the way for him to such a belief, to faith, is of course not the business or job to be carried out by a psychiatrist, but rather by a theologian.
In terms of questions, in a Socratic dialogue and working with individuals, some of them, I point out that some of the most important things that we do in terms of suffering and in trauma is we do spend time talking about the past and what has happened, but therapeutically, as a clinician, I'm really trying to listen closely for when the person starts talking about now and moving towards the future. Once I hear that future talk, I kind of go, ooh, this is good stuff. Because the person, it's that ever important notion of like they go from victim and then slowly they reconceptualize that. And they create some meaning where they say, I'm not a victim, I'm a survivor. And sometimes in practice I use the terminology, it's like, even I'm a survivor, and now I've even gone beyond that. I'm like a warrior, and I'm going to go out and do something because I've learned something or I've found something, some meaning through this thing that I highly would prefer that it never happened, but it did happen, and I can't control that, but I can control how my approach to what happened. I can think of myself more as a survivor and even a warrior. Or this notion that Frankl talks about, taking tragedy and moving it perhaps in a redemptive sort of way to a triumph. This is hard work. Some questions in therapeutic settings that we use, examples of questions. What is your previous life suffering preparing you to do with the rest of your life? It's paving the way for something. Which of your life challenges have taught you the most about your own resilience? What sources of strength did you draw as you faced these challenges? What have you learned from what you've gone through? Or what is something that you overcame, and what did it teach you about yourself? Have you seen anything good come out of a seemingly hopeless situation? Is there any possible good that emerged from your own traumas? One clinician says, we deal a lot with PTSD, post-traumatic stress aspect, as people go through the process, which sometimes can take some time to try to kind of move it towards maybe there's, not to say we just totally ignore what happened. It's still there. It's a change in orientation where a person talks about a post-traumatic success. One other example, therapeutically at times, we know that people live by stories. In fact, even if I were hanging out with you and I asked you like who you are, you would probably start telling me your story. I was born here, I grew up doing this, I come from this family. These are all stories. We live by stories. We take a narrative approach to understanding ourselves and how we, fit into this world. And clinically, sometimes we use this notion of seeing your life story as a hero's journey, increasing meaning in life. It's based on Joseph Campbell's notion of a hero's journey. Have you heard that before? Yeah. And it's like all the great stories typically have a sequence related to this hero's journey. But therapeutically, sometimes we talk to the person and say, let's talk about this journey And guess who the protagonist is in this story? It's you. We start talking about the person as a protagonist. And we kind of take the sequence and say, like, let's go through your story. Like you have strengths and virtues. And you are a protagonist. And like any good situation, at times you find yourself in new situations. And the stories that you have, a lot of them are about you encountered a new situation that you were unfamiliar with. And typically there's some sort of goal, you're working towards something, or something happens, some form of trauma, some adversity, something that you would never choose for yourself. And you have to kind of work through that. And that's kind of the challenge there. But as you go through that process, you have to find your resources. Who are your resources? That has a lot to do with resilience. Who do you rely on for supports? Good friends? Anybody in your family? If there's nobody in your family, we go beyond that. Say, where are those strengths, those relationships that are key to what you're doing? And we talk about what's that challenge. Has that challenge, even though you never would have signed up for it, has it given you some set of purpose or sense of meaning? And through that, is there any sort of transformation? Let's find out what that transformation is and identify that. And typically, when we think about going through this process, or going through life in general, as you kind of go through this hero's journey, there's something about the impact. Why are you doing what you do? How is it going to serve others or impact others? And that can be a useful strategy to think about yourself on the hero's journey, and you can adapt that to many different domains. Folks, we're out of time, but you get the gist here? Logotherapy basically is, the meaning of life is to give life meaning according to prompting and so forth. Just one therapeutic approach amongst many, but one that clinicians, including myself, use. If you're interested, it's just a Google away. Look at logotherapy. I encourage you to look at Man's Search for Meaning, his thesis on logotherapy. And we're full this year, but each year we go to the world's capital of therapists, Vienna, Austria. I take it over down. Go there in years to come. So if you're interested, keep your ears and eyes open for that. Thank you.